Good day, my dear exam going undergraduate students. Now, I take you to a seemingly small topic, but then this has been a source of consistent questions for the past many years. They will be mostly short notes or MCQs and definitely may occur in the Viva or as charts. Nutritional disorders is one, and these are the usual questions that can be asked and will be covered. I start with obesity. Surprisingly, this was asked as a question for the undergraduates, and since I had covered it in my book, the students had done well. When a question like this is asked, you people will have to define what obesity is. It is supposed to be an imbalance between the nutrition and the requirements. And it is mostly measured by means of the body mass index. There is a cutoff value which I would like you people to kindly mark in your books. Many reasons have been quoted, such as overeating, inactivity, genetic, etc. So there is a list of causes which I would like you people to kindly go through. It is a general knowledge question and we cannot afford to lose marks because it comes as a university question. So there are the various sources, including R.A.T.S that has been given. Regarding the pathogenesis, one thing that is very important about, look at your book. The class is supposed to be followed with your book. There is the pathogenesis in the form of leptin, adipolectin. See whether these words are found. And there will be a cycle that is given which takes us from the adipose tissue to the hypothalamus and then back to the energy stimulus. So this particular cycle that I would like you people to draw, it will help us score marks. And there are certain changes that can occur in the body that should be mentioned. For example, there can be a development of diabetes, there can be hyperinsulinemia, obesity. It can lead to osteoarthritis. Then there can be a deposition of cholesterol, atherosclerosis, and sometimes it can predispose to malignancy. All these are given. And I have mentioned two genes in my book. One is called the OB gene and the other is called the DB gene. So kindly mention these. It is not a usually asked question, but when it is asked, we should not be taken by surprise. What are all the other things you will have to measure is given. Protein energy malnutrition, a must-know question because it is definitely a case for you in pediatrics and a university question in community medicine pediatrics as well as in pathology. And there are classically the two extremes, marasmus and the kwashiorkor. You people should know the differences between the two, which of which is a calorie deficient and which is supposed to be an energy deficient one. Marasmus occurs in starvation, whereas kwashiorkor is related to protein deficiency. So you people should know the clinical manifestations. For example, there can be growth retardation, there can be an infection. In kwashiorkor, classically, my professor used to say, there will be an Indira Gandhi-like hairstyle. That is called the flag sign. Then dermatitis, dermatosis can all be there. The child will be apathetic. What are the things? And the viscera, the fatty liver can be a manifestation. These are all given and there will be an atrophy. And hopefully these will be corrected if proper nutrition is being given. And any of the nutritional disorders, the child can be prone for an anemia or infection. Marasmus is another one. Generally in Kwashiorkor, the child is supposed to be apathetic. I would have given a tabular column. Any of the books will be giving. Kindly by heart the tabular column. So if anything comes as a question, you will be able to write that. So go through the features, go through the tabular column. And what is the exact definition you people should be able to mention. I covered two important things. Now coming to the vitamin. Vitamin A deficiency. This you would have read in your biochemistry in the first year itself. And what is all the source of it? What is the retinol? And what are the coloring substances in the eye? How do you get a color? Otherwise, there can be a color blindness, there can be a night blindness which can occur, white hot spots, keratomalacia, etc. These features you people will have to. So they can ask you as a seemingly tricky question, but the answer will be very straightforward. So, how is the vision being controlled? And when it comes to the deficiency manifestation of vitamin A, please divide it into two groups. One is extraocular, the other is ocular. Extraocular, it will occur in all the epithelium. There can be a hyperkeratosis. There can be a squamous metaplasia. Sometimes there can be even calculi formation. Ocular will be night blindness, conjunctival cirrhosis, white hot spots, corneal cirrhosis and ulceration, keratomalacia, etc. So these things you people will have to. So that will be important for you. These can come as short note. We cannot afford to lose marks. Sometimes hypervitaminosis, it is more of a pharmacology one, but then we can make a mention of it. So this is what is important. Any of the questions, they can come as MCQs for us, short notes in Viva OC, or sometimes they can be presented as charts. The next one will be vitamin D. Vitamin D, all of us know that there will be a cycle that is important. So what are all the things that are important? Hydroxy, calciferol, etc. will be important. Cholecalciferol, hydroxycalciferol. There is a line diagram that is given, and you people will have to substantiate it with the parathyroid and then the sunlight, etc. sources of energy. And what can be the manifestations of it? In children, there will be rickets. In adults, there will be osteomalacia. So what are all the clinical features? In any of the diseases, we must know the clinical features. Again, a stunted growth will be there. Then you people will have to mention the beading of the ribs. That can be the bow legs that can be present, etc. Craniotabes, Harrison sulcus, Rakiti rosary. All these have been mentioned in your books. Kindly go through them. Any of them can be asked as MCQ, or this can be a question by itself. Fractures, etc. Fine. Another one is vitamin C deficiency. Vitamin C is important to us because pro-collagen to collagen, that will be deficient over here, as a result of which the patient can be having bleeding, and one of the causes for delayed wound healing, etc. What is a hemorrhagic manifestation? Skeletal manifestation. There is a decreased formation of the osteoid matrix. Delayed wound healing. There can be anemia, a normocytic, normochromic anemia, etc. Skin rashes. And scurvy itself had given as shades, a pneumonic. That can be skin discoloration, hemorrhage, anemia, D for dental issues, exhaustion, and swelling of the joints. I would like you people to kindly mention all these. So vitamin C can be asked as a question for us. Vitamin A, we have finished. Is it clear? So these three are important for us. And that comes almost to the end of it. So this is what you people will have to know. I have given this just as a prototype. Any of the nutritional disorders, we should know what are the causes for the disorders and what are the defects. For example, there can be bleeding gums in a case of a scurvy, or there can be a delay in the dentition and the milestones, etc. Collagen to collagenase. So that can be the defect in it. Vitamin D, for example, without the cycle, your answer is incomplete. What is osteomalacia? What is rickets? and what are the manifestations. What are the pathological features that are exactly over. For example, vitamin C, it has to be the conversion of co-collagen to collagen. So these things I would like you people to kindly answer well, and that will be the thing. There can be other vitamins that are given, but these you people can go through. That brings us to this class. Thank you.